Welcome back. I'm Stephen Dunn, your holistic physical therapist in Austin, Texas. In part one, we talked about our unique approach to total hip replacement rehab. Today, let's dive into how we create your personalized recovery plan. No two hip replacements or patients are alike. That's why our first step is always a thorough assessment. We look at your mobility, your strength, posture, and even your daily activities. Are you a golfer, a gardener? Do you love to dance? Maybe you play pickleball. We tailor your plan to help you get back to what matters most to you. Using manual therapy, I work on soft tissue tightness, scar tissue, and joint restrictions to improve your hip mobility. Then we integrate Pilates-based exercises to build strength and stability, especially in your core and pelvic muscles, key for protecting your new hip and preventing future injuries. Gyrotonic exercises come next, bringing fluidity, coordination, and full body integration into your rehab. This unique system helps you move with ease and confidence. So you're not just stronger, you're moving better than ever. In our next video, I'll show you how this holistic approach empowers you to return to the activities you love safely and with confidence. Stay tuned, guys.